Thank you for joining us. My name is Terry Paris Jr. I'm the engagement director for The City, which is a nonprofit news organization that covers the city of Detroit. Sorry, I'm from Detroit, the city of New York. So still ingrained in me. I apologize. Anjali, do you want to introduce yourself?
Hey everyone, welcome. My name is Anjali Choi, and I'm an independent reporter and editor here in New York. Over the past year, I've been working as a project editor and coordinator for Missing Them through our partners at Columbia Journalism School.
And my name is Derek. I work at Columbia University's Brown Institute for Media Innovation, which is a nonprofit think tank working on journalism projects and data. And also just want to let everyone know we are recording this panel. If for some reason you don't want to be recorded, just keep your video off and we'll go from there.
Excellent. Well, again, thank you so much for being here. We're going to talk about our project, Missing Them. Before we get into it a little bit, we want to play a little video of what we're actually talking about here.
I don't watch the news as much anymore, but I know that we don't get enough representation. That's all I know. And I think that it makes it a lot harder to deal with this because our grief is very unique. So I thank you guys for everything that you're doing in this little memorial piece. I'm really grateful for being here. My mom was just like everybody else in New York City. And when I speak about my mom, I think about all of you.
She was a fighter, and she was definitely a fighter in the hospital. And we went through a lot with the hospital too. She passed away April 19th of 2020. And I just like the obituary that that was written by my mom from the city. So I want to thank you, the organization, for doing this. This really helps out us. And I think it helps out me a lot to memorize my mom. And I'm sure everybody else too, who lost a loved one.
I want to thank the creators of this project for giving us a voice and for inviting me to share my sister with you. Her name was Mary Margaret, but I called her my pumpkin. And this is a picture of us, fairly recent. My sister was born on April 19th, 1960. The doctor took one look at her face, holding all of the obvious signs of Down syndrome, and told her parents not to take her home. She would not live past 2, he said, and it would be foolish to get attached. She lived past 2 years. My sister went to school. She took ballet classes and was in a show every year.
My name is Caridad. This is my sister Elsie, and I'm here with my mom, Digna Lebron, and we're here to talk about my brother, Alberto Lebron. We may watch updates about COVID-19 on the news or read about it online or in the papers, but until it touches you, it seems to be something unreal that is occurring in the world. It is so real, and the damage it leaves behind is so devastating. Today, we are bound together in this journey of grief because we've experienced the loss of a loved one.
My mom was Etta B. Alston. She moved to New York from Florence, South Carolina, to New York City in the 1940s during the Great Migration. And after having children and getting married, later on in life, she attended college. Something she always wanted to do was to attend college, but the options were really slim for African-American women back in those days. But she attended college after her kids were grown. So I'm gonna ask my nephew and her grandson, Kenneth, to just sing that song briefly.
When we all get to heaven, what a day of rejoicing that will be. When we all see Jesus, we will sing and shout the victory.
We'll talk a little bit more about Etta James a little later in this presentation, but that video is always very emotional. So what is this project? This is Missing Them. This is a programmatic New York memorial and accountability journalism project. And the goal of our project was to name every New Yorker who died from COVID and to focus on communities of color, to focus on equity and communities of color through what we could find publicly, but also through sort of engagement and crowdsourced responses. We started in April We started thinking about this project and gathering the data in April, what was reported publicly. And then we launched it in May with a call out asking folks to participate. Coming in and we did this with the Columbia Journalism School. By June, we were working with the Craig Newmark School of Journalism and a various group of other non-journalism partners, including the Lincoln Center, the Brooklyn Public Library, social service providers. And we ended up building a digital memorial that looks at that pulls in all of the names that we have found so far publicly, as well as all of the names that families have shared with us, including stories that we've written, which we'll get into in future slides. This memorial refreshes with city data from about COVID, as well as all of the obituaries, the pictures that we put onto the memorial, written by reporters and students and volunteers, as well as vetted by editors. We've also done, as this is an accountability journalism project, more than a dozen stories that looks at various things in nursing homes and environmental justice. The project is also sort of evolving an experimental project that is incorporating theater and physical memorials and various other ways in which organizations are able to use what we've put together to build their projects or their own memorials, which we'll get into in a minute. But where did we start? What did this all look like, and why did we get here, and how did we get here? It started with sort of the three of us thinking about, what was being publicized already at the beginning in March and April, when there wasn't a lot of information, there wasn't a lot of data. No one really understood or knew exactly what was going on, but there were publicized deaths. There were obituaries in legacy.com, various other news organizations. And so we started collecting those. And what is a publicized death? Those are defined as accompanied by a victim's name and any other identifying information, such as age, home borough, next of kin, sort of looking at that, making sure that there is some line or connection to COVID. And in that first look at what was publicized, we found, and probably not shocking, but we found that fewer than 5% of those New Yorkers that were dying were remembered by staff written obituaries or any other death notice. Historically speaking, these obits, and this was not shocking, but skewed male, they skewed younger. They were also disproportionately coming from wealthier enclaves of the city, like Manhattan. And we also, in this sort of first analysis of what was publicly reported, realized that, and again, maybe not shocking, but saw that the areas that were being hardest hit by the coronavirus, Black and Hispanic residents and, recent immigrants living in poorer areas or more densely populated neighborhoods like the Bronx and Queens were sort of getting unnoticed by anyone other than, their families and coworkers and friends. And while that might be fine in the idea of like what is the memorialization, what is remembering, but we folks look to journalism or look to media and papers for sort of attention or validation or affirmation or remembering, and then as we dug into this, realized that obits themselves are also fairly expensive. So for example, the average obit cost in the New York Daily News is $600. So even in death, even in this idea of dying, there is still a divide in who can and cannot afford to be remembered. So looking at the data and looking at the cost, it's sort of, we all sort of realized that it wasn't merely just a collection of data and a data project, that it was a citywide endeavor to see and figure out how we could have what was being publicly reported be more real to what is happening on the ground. And we also knew that we couldn't rely just on publicly reported deaths, that we had to figure out ways as a news organization to reach out and be proactive in how we are able to connect and engage with folks who are not just coming to the city.nyc or going to the New York Times or whatever it is to try and get an obit. So we developed a large engagement, apparatus that included many avenues for people to share. A Google form, a text message. You can text remember to 73224. You can call our hotline. You can email us. And in each of these four avenues, we are asking people to, tell us who they are, tell us who they lost, give us a short story about what made them unique to New York. But we didn't just stop there. The idea was to create these avenues and then proactively put them into places where we knew we wanted to reach people. And that included things like joining 100+ Facebook groups and going into these Facebook groups to post these avenues. That meant creating a list of all the funeral directors that we could find and emailing them, the opportunity or the idea that their folks could participate here, making a list of all the AME churches in New York and reaching out to those communities. We even had one intern. We even had a physical flyer posted in some of the NYCHA complexes. So we were thinking of how could we proactively reach folks in all the different ways that didn't require them to sign up to a nonprofit news organization's newsletter or like type in the URL. And that sort of kind of led to a collection of stories and data that my colleague Anjali is going to talk a little bit about.
So like Terry mentioned, we realized pretty early on that COVID-19 was having a disproportionate toll on communities of color. And we wanted to make sure that our memorial truly affected who in New York City has been dying from the virus. In this engagement effort that Terry has described, everything from posting in Facebook groups, putting up flyers, and then identifying and connecting with community connectors has been really key in making sure that missing them truly affects who's been most affected by COVID. So from the outset of the project, we've been keeping track of metrics like, where people died, which borough in New York City, race and ethnicity, and gender. So early on, when we were relying solely on information that was publicly available before we began our engagement efforts, we realized that a lot of the stories that were out there skewed male, mostly people who died in Manhattan and in whiter neighborhoods around the city. And with time, we've seen how crowdsourcing has been able to help us create a more equitable and representative memorial that's more closely aligned with the actual death toll, both by race, gender, and borough. So here I pulled together a little chart and you can see the citywide death toll by race. And over time, we've been able to align a lot more closely to these numbers. So currently, people who identified as Hispanic or Latino, they're about 30% of the crowdsourced submissions that we hear from, and they represent 33% of the citywide death toll. We, as you can see, have more work to do to make sure that the Black community is properly represented, and are working very hard to think of ways to actively engage with different communities. And the more that we can sort of turn to, volunteers with a connection to the community or talk to people who have been doing organizing work for decades in these communities, the better we'll be able to serve people in these neighborhoods. And then I quickly just want to talk about gender as well. So by our tally, early on in the pandemic, roughly 70% of all obits that were out there were of men. And even though men are slightly more likely to die of COVID, that was really kind of skewed. And with time, we've found that by going directly to communities, inviting them to participate in our project, we've been able to create a more equitable balance. So currently, women represent 37% of all our crowdsourced obituaries, and they make up about 41% of the city's death toll. And over time, we've been able to see how crowdsourcing has really helped us reach people in the outer boroughs, especially Bronx, Queens, and Brooklyn. And part of that has also involved turning to existing grassroots obituary efforts happening in those boroughs. So, for example, in the Bronx borough president also maintains their own mini memorial. So we, made sure to set up a call with them and introduce ourselves, and have kind of collaborated by keeping an eye on, who's submitting to them, and how we can better capture all those stories.
Great, and I'm just going to talk briefly about the work so far and what the numbers look like. So the memorial page, which we'll put on the screen at the end, but you can go to thecity.nyc and see for yourself. Right now, there's about 30,100 COVID deaths in New York City. We have identified and have names and information about roughly 2,000 of those that have died. And that represents almost 7% of the citywide total. So obviously, it's a very large number, and speaks to how difficult it can be to identify many different types of New Yorkers and people that have died from the virus, and how much work we have left to go. Of those 2,061 New Yorkers that we've ID'd and vetted and published, we also have obituaries for 302. And what we mean by that are mini life stories, usually between 3 and 6 sentences, that are staff written by either an intern, a student at one of the journalism schools we work with, or Boston College, or volunteers. And so that 302 is, again, not a gigantic number, but we think it's a good representation of who's been dying of the virus in New York. And a lot of these staff written obituaries have come from crowdsourced submissions. So people that are family or friends of those that have died, submitting through a Google form information about their loved one. We have about 800 plus submissions from family and friends. And even with the declining numbers, thankfully, in the last month or so, we have 61 crowdsourced submissions just since March 1st. So that just speaks to sort of the need and importance of trying to get this information out there. One other thing I wanted to mention, aside from like the visual shows here on the left, in some cases a photo, a name, an age, their borough and date of death, and of course their staff written obituary, we also try to group people a little bit, because we found that not just the families appreciate affiliations to NYPD or FDNY or hospitals or other healthcare facilities. They would like to make sure that their loved one is connected with those groups that were important to them in life. So we've developed 12 different groupings by occupation. And initially, what we wanted to do was to make sure that frontline workers, essential workers, were properly sort of recognized in this grouping. So that's why we have, again, healthcare, doctors and nurses, and other folks who are required and working on the front lines. And so I think, launched that over the summer or the fall, and we are constantly adding to that. I'll just briefly intro this. One other thing I wanted to mention, not on the last slide, but just generally, the vetting process for this is a little involved. It involves people, various staff members and interns and volunteers, not just finding the information about the person, the name, age, borough, but making sure that they lived and that they died. And also collecting back-end information that we don't publish, including addresses. So we use proprietary databases in order to connect people that have died with specific zip codes, 5 and 9-digit zip codes, so that we can properly sort of visualize and see where people are dying in New York City. It's an imperfect method. I mean, as anyone knows who's registered to vote in New York City, or filled out a utility record, sometimes those records are not kept up to date and not accurate, but they can be the best indicator for where someone generally lived up to a certain point in time. So that's useful also as a way to capture that we are capturing the New Yorkers who are dying from the virus. On the next slide, we're going to talk a little bit about the partners here, but I just wanted to mention that we have a lot of different journalism groups, but also a lot of different volunteers and folks that are completely unaffiliated with New York that are helping with this project. So let Anjali talk about that.
Yeah, pretty early on, we realized that this is such a massive undertaking and too big of a project really for one individual institution, one newsroom to tackle. So over time, we've really relied heavily on our partners, and we work with students at Columbia Journalism School's Scipio Center for Investigative Journalism, as well as their postgraduate program, Columbia Journalism Investigations. We've partnered with classes and summer interns from the Newmark Graduate School of Journalism at CUNY, as well as a service learning program for undergraduates at Boston College. And then aside from these more academic type partnerships, we also have a small but dedicated group of volunteers who have been really instrumental to making sure that we can get back to families in a timely manner and write and publish obituaries. So here you see a kind of screenshot of one of our Zoom meetings with volunteers. So now I'd love to share a little bit about how our obituaries come together. And so all of our obits, and to date, we've published around 300 of them, with 50 more that are in the process of being edited. And each one of these obits typically begins with a submission from a family member, friend, or coworker. So over the past year, we've heard from more than 700 families who either filled out a Google form, they left us a voicemail, or sent us an email. And early on, one person that we heard from is Leslie Alston, the daughter of Etta Alston, who died during the early wave of the pandemic. And over here on the right, you can see the initial message that she sent us as part of the Google form that we have out there. So on May 8th, we got this message from Leslie telling us about her mom, who was a grandma, church mother, aunt, cousin, and friend, and had worked in the community for 67 years with youth. She talked about how her mom had helped many immigrants get their green cards over the years at INS, where she was an immigration officer for 27 years. So one of our reporters, Beatrice, got in touch with Leslie to find out more. And in the course of the interview, she learned about how different things were now with COVID, and families weren't able to gather to grieve or either to kind of in-person funeral. So we actually ended up publishing a story that featured Etta's story as well as the obituary. So here on the left was a piece that we published in May about how families are paying a high price, both economically and emotionally, psychically, when their loved ones die of COVID. And also the obituary that was published on our website featuring Etta's life story. So with all the bits that we publish, we always make sure to send the link back to the family so that they can share with their friends and loved ones. And if we could go to the next slide. Sometimes when we hear from people, they're not just mentioning a person's life story, but they allude to an issue that they face when dealing with their loved one's illness or death, the aftermath of death. So one example that I wanted to share is that of James L. Hutcherson. He was a World War II veteran who for a number of years had been living in a veteran's home in Queens. And just a few days after he died, we heard from Yvonne Parsons, That's her here on the left. And she wrote in and told us, I'm not happy with how they treated my dad at the veterans home. They called me Monday morning, 5 a.m. and told me that he fell and my dad died on Wednesday morning. I'm so upset with the way this whole thing was handled. So our reporter who was assigned to write James Hutcherson's obituary got in touch with Yvonne. And through the course of the conversation, he actually learned that James Hutcherson was administered an experimental treatment for COVID while he was at the veterans home. It was a mix of hydroxychloroquine and azithromycin, which was really at the time being touted by President Trump. So after kind of months of digging, I think it was about 6-7 months in total, he was able to find out that this wasn't a problem that was just occurring with Mr. Hutcherson, but that there were more than 60 people in this veterans home that was run by New York State that was administered this experimental cocktail, and oftentimes without family consent. So we partnered up with Type Investigations to publish this story. And I should mention Dean Russell, the reporter, was a fellow through Columbia Journalism Investigations. And this was, really, key example of the kind of accountability reporting that's come out of the project so far. So on one hand, the obituaries are really about, celebrating someone's life, but we're also always actively keeping an eye out for accountability issues that we hear about through these families and friends.
And just following up on that, a second similar example, we got a tip from someone who works with a bail fund in New York City, saying that a 60-year-old inmate who had died at Bellevue or actually had been at Rikers previously had died, but had not been included in New York City's count of inmates who have died in custody from COVID. So we had a student, actually a current student at the Stabile Center for Investigative Reporting at Columbia Journalism School, follow up on that, just ask questions to officials. And in the course of his reporting, he found that not only was this one person not counted, but several others were not counted, even while the city was fairly openly saying that there were only 3 deaths of inmates in custody. They weren't counting those who had contracted COVID and then subsequently, after compassionate release or some other type of administrative release, then subsequently died, either in a medical facility or after being discharged. So this was just normal accountability reporting, and is a good example of, it actually led to the mayor calling for a full accounting of these deaths, which is a great piece of impact and an important sort of step in any type of accountability journalism that we produce. On the next slide, we sort of run through a little bit about all that accountability journalism that has come from the project, because it's one thing to celebrate someone's life, it's another thing to actually answer questions that come from their death. We did a mapping and a data story on air pollution and COVID near crossways in the Bronx. Anjali and another reporter from the Bronx, S.A. Olam Hensei, is working on that story for a podcast, which should come out in the next month or so. The most read story in the city newsroom's history has been a data analysis of the disproportionate number of 9/11 survivors who have died from COVID. We have, in the course of collecting all of these names and information, we've had a particular eye on those who were survivors at Ground Zero. And so we've had 2 different stories come out now about 9/11 and the impact of that. We have a forthcoming story. I don't think we're sharing anything too privileged, but we have a forthcoming story about Hart Island, which a lot of people know about as the city's Potter's Field, where folks are buried. And because of COVID, this has been one of the worst years in Hart Island's history, which dates back to the Civil War era. 1 million people are buried on that island, but we have a team of journalists who are working on scraping the Department of Correction site that runs and administers Hart Island at the moment until they transfer to Parks and Rec. They are scraping all of that data, doing analyses on who has died, where they lived, where they died, and where they come from, race and gender, and all of that. And that's an important story to, again, give another bit of voice, but also story and accountability to the most vulnerable New Yorkers who've died of the virus, those that are disproportionately from the Bronx and Queens, that are Black and brown, that in many cases didn't have quality access to healthcare.
And as this project is trying to think beyond sort of charts and graphs and numbers, and really listening to people that to give them an avenue for sharing their story, as well for getting some accountability reporting done. We also were hearing that families were having a hard time connecting, coming together to grieve and to mourn. And we were really kind of plugged into that need. And so in December, we held a 3-day event where we had about 750 people join us over the course of 3 days. And we had a varying degree of programming, from poetry readings, writing workshops around grief, not just what folks were missing, but what folks were feeling inside, turning those into productions and plays. During that weekend, we had an independent director and actor, Reza Salazar, take our reporting and our interviews and create a 45-minute theatrical experience based on those interviews. We had roundtables around health and trauma and reflection circles. We also had 29 families where we pull the video that you saw at the beginning of the presentation, share stories about their loved ones coming together and sometimes reading the obituaries we've written, or reading poems and stories that they've written themselves, or letters from their families, or merely just talking about the person. And it was an incredibly moving event for everyone involved. And there was a lot of connection happening in the chat and on the screen. And it would just sort of realize that this is, as a result of COVID, sort of changed the terms of grieving and changed the terms of mourning. And people were not able to sort of come together in that same way, not just to be remembered through obituaries, but to connect to each other. And in our small, tiny little way, we tried to do that in December during this event. We had partners from the Brooklyn Public Library, Morris Jamel Mansion, nonprofits like Care for the Homeless and Urban Pathways, as well as other memorial programs like Naming the Lost, and various other actors, performers, and mental health experts all come together in a volunteer basis to bring Missing Them into a real, albeit virtual, space. Which leads us to this last point here, that the program, the project, the idea is evolving and expanding in different ways. On next week, you'll hear WNYC, Brian Layer's program reached out. They got their listeners to read 1,700 of the names that we've pulled. There's other things that are happening. Derek, you want to mention a couple of other things?
Sure. The mayor's office, which might also be on the line, they're working on a memorial project, an event actually, for 7:45 on Sunday. I don't know if all the details are out yet, but it will be a public memorial of those that have died in New York over the past year. The image that's on the screen right now is from Morris Jamel Mansion. It's the Covita art installation that was done by a very talented Mexican artist, and incorporates names of those who have died in New York and elsewhere in the country into ribbons that are actually tied onto the fence outside Morris Jamel. And there was a public talk and gathering for those, and that was in the spring. And we have some nascent partnerships with other groups around New York City, including one that I'm particularly excited about, and others are Hostos Community College in the Bronx, a team of students who are interested in working on first person and some type of immersive storytelling surrounding the virus that might result in journalism and might not, but are important ways to connect to the communities that have been most impacted.
One other thing that we would love to put on everyone's radar is that at the beginning of May, which will be the year anniversary of our launch of this memorial, we'll be putting on a theater production inspired by missing them, and partnering up with the Working Theater, which is an incredible theater company in New York City that produces theater both about and for working people. So the frontline workers, bus drivers, postal workers, doctors and nurses. And this will be a second iteration of the play that director and actor Reza Salazar wrote for the December event. That we'll be sure to share that information with all of you as we get closer to it. So thank you everyone for coming today. I know it's early on a beautiful Saturday morning. We so appreciate your interest in the project. We're really excited to continue this work. There's so much more to do in terms of reaching people who've been affected by the virus and making space to remember folks. So we just want to take a minute to open this up for questions. Feel free to turn your camera on. And if you ever have feedback or an idea for us, or if you're interested in collaborating, we would love to hear from you. You can reach out to us at memorial@thecity.nyc, and I'll put that in the chat as well.
And I see a few questions in the chat, so I can just quickly go through the first two and then open it up. Emily, you're asking, what are you learning about how to make this effort accessible to more people? You mentioned many strategies like non-digital phone outreach, also community partners. Terry and Anjali can speak to that. How are you thinking about making this effort a safe place for people to share their memories for those who haven't interacted with the press before?
Those are all really good questions. And Anjali and I, we think about these all the time. What's really interesting about the idea of a safe space is in a lot of ways merely showing up and creating a place that they can share is, we found that there's not a ton of apprehension. People want to share these stories because they feel, particularly in this environment, they feel that they can't. But we are very attentive to those responses, those emails. We try to respond to everybody as soon as possible. We try to create an environment in which, when we are writing and reporting, that we are collaborating with the family, as opposed to extracting that story, publishing it, and then randomly just saying, well, here's the link. So we tried to share those things with the families beforehand, to exactly what the question gets to, is to create that safe space, to build that relationship, to sort of a collateral idea to this is to change that relationship between a newsroom and the community that it covers. There are a lot of issues, or there are a lot of limitations, particularly around language, that we are trying to actively think of. Like, language is it's a resource. At the end of the day, it's resources. But this is definitely something that we think about, and there is a limitation there. And how do we reach as many people as possible when some of the project is only in English? We do have the form and the text translated into Spanish, but we sort of need to think more about how can we reach out to those communities specifically, and that all comes down to a resource question. Anjali, anything you'd like to add to that?
Yeah, thanks so much for the question, Emily. I think, on the accessibility front, one big thing that we would really like to do, especially as we reach this year-long marker, is to be able to translate our call out forms into some of the major languages that are spoken in New York. One thing you mentioned is the phone outreach. So it's been really, really helpful for us to give people the option to leave us a voice message. And often we'll hear from the seniors who don't have a cell phone and they're calling us on their landlines. So we know that that population is less likely to want to fill out a Google form or email us. So just having these different ways of reaching the project has been super helpful. And then the point about community partners has been really key. So one example, early on in the pandemic, we connected with a doctor in the Bangladeshi American community who was putting together his own spreadsheet of people who had died in that immigrant community and shared 200 names and stories with us. Those are stories that maybe were reported in local media in another language that would have been quite difficult for us to find on our own. And more recently, we just had a call with South Asian Youth Action, and the organizers there were willing to blast their entire listserv and talk about missing them in a hyper-local community conference. So it's really through these kind of individual relationships and connecting with groups that we're able to reach as many people as possible.
Second question here from Faraz. This is a great and important project. Thanks to all involved. Thank you. Were there any demographic groups, occupations of people, or neighborhoods in your data that you find are surprisingly unrecognized or talked about in the mainstream media? I might be able to say just a line or two, and then Anjali and Terry, feel free to jump in. But so, frankly, and this is not off the record, so all of this information is public. So, but when we look at the occupational data, I think this should come as no surprise, but I think people are surprised by the number of frontline workers that have died, including those with the MTA and other occupations where they're critical to functioning of city services. We've the MTA number has been public, but also connecting that number to actual human stories and the work that they were doing, maintenance or otherwise, is important. Neighborhoods are very difficult to pinpoint, where reporting is lacking, because in a lot of cases, we found that clusters of death happen in places with poor, generally poor health outcomes, separate from COVID. But we, SA and Anjali, are working on a story about air pollution in the Bronx, and that's an area that when you map out the clusters of those that have died, there is a natural grouping of those near the highways and the crossways there. So that to us stood out and necessitated some reportage. But I'll let Anjali speak to that.
I think what's been really helpful is to be able to turn to existing data sources to understand which communities have been hit hardest by COVID. So currently I'm working with SA, a former reporter at the city, where we've taken a look at the EPA's data on air pollution in sort of census tracts and zip codes around New York City. And we've seen how there is actually a bit of a correlation between neighborhoods that were hit hard by COVID and where there was, elevated levels of air pollutant from the particulate matter. So what the Missing Them Memorial enables us to do is to really put, a face to these statistics and be able to reach out to families in these neighborhoods and talk to them about, whether their loved ones, say, suffered from asthma as a result of living in that environment, and how that might have contributed to their battle with COVID. One other thing I'll mention is that, New York City's own zip code level data on, how specific neighborhoods have been impacted with COVID has also been really helpful. And we take that information in, and then it helps to inform our outreach efforts. So, last year, the city published the names of the 10 most hardest hit NYCHA communities. And those were the 10 communities where we decided to focus our flyering efforts. And we know from the first wave of the virus, there were certain neighborhoods like Elmhurst and Corona and Queens and neighborhoods in the South Bronx that were hit hard. But we've also seen how in the second wave, neighborhoods like Richmond Hill in Queens have popped up. So making sure that we're really attuned to the different kind of clusters and outbreaks that are happening around the city and connect with people on the ground there.
And I also like to add too, is I think when we think about the idea of mainstream media, I think you could go to any sort of memorial effort and find representation from all the communities. I think the difference here, like even with the New York Times or any other sort of memorial, there is probably this idea like of rounded representation. I think the difference for us is that this is a concerted and committed effort that goes beyond sort of finding that one representation, but like looking and committing to figuring out how do we get more people involved from these areas? How do we get more people to share? How do we get more people to participate? And how can we continue to do that? And so, you look at the names of all the other sort of memorial efforts that are all important and great. And I think that they are represented, but they are represented in a sliver as opposed to a larger sort of concerted effort, which is why missing them as a programmatic sort of project that is continuing and committed to figuring out how to get more folks to participate, not just on that one day, but over the course of a year.
We're almost at the end of our time, but if there's any final questions for us, and we can also respond to email.
I have a question I'd like to pose. So I also really appreciate this project and think it's really important. I'm wondering if there's any ideas in the air right now of looking at the devastation for families that are left behind after a family member has died from COVID. I work in the Bronx at a nonprofit, and we see people who come needing, food services because they've lost people in their households, which means that they also lose significant income in the household, and they're in a situation where they've never had to seek food pantry services. But particularly, I work with people who are facing possible eviction and have a lot of clients who have members in their household that have died, and they've lost significant income because of that, and now are facing not being able to pay their rent, and eventually seeing down the line that they could be evicted from their home. So I'm wondering if you guys are thinking about extending the project to look at what the impact is on the family members left behind.
One thing I'll just quickly mention, and then Anjali can speak to it, but the Hostos Community College students are, most of them are frontline workers, and most nursing in particular, and most of them have pretty revealing, important stories to tell about the financial and other impact of COVID on their families, not just a loss of life. So we hope to explore that in the coming weeks and months. But I also know Anjali's been working on a story that speaks to that.
Yeah, Clarissa, thank you so much for sharing some of the stories from your work. I think that's something that we have noticed too in talking to families, how it's not just the devastation of losing a loved one, that there are these ripple effects, both economic, mental and spiritual, that come from this loss. And so coming up, we have a story that's in the works about the financial impact of losing a loved one to COVID, especially someone who is the breadwinner of the family. So our reporter was able to talk to people who are now considering selling their home because it's the only way to continue to stay financially afloat in families with young children that are really struggling to get by. And separately at the city, there's been reporting done on Chuck Schumer and AOC's proposal to help compensate people for their funeral expenses. That's something that we've heard a lot from families about, how even the process of laying their loved one to rest has been a huge struggle. But of course, the financial impacts go beyond the funeral and kind of continue to affect people's lives for years to come. I think that's a really important point. And we'd be really interested in connecting to offline to hear a little bit more about the stories that you're seeing through your work.
I'd love to. Thank you.
Thank you.
Well, we're up to noon. Thank you so much for joining us. If there are any other ideas or questions or thoughts on collaborations or things that we should do that we haven't done, any of that stuff, where as you may have gathered, this is a expanding, experimental, evolving project that is not just one project of the city as a news organization, but a project of the city as what we all live in. So we really do encourage you to email us at the email that Anjali dropped in the chat for any and all of those things. Groups that we haven't heard from, families you may know, all of that is so important to this project. And we don't get here without the participation and contribution of folks like yourselves, not as representatives of organizations, but as representatives of the city of New York. So please reach out to us if you have any of those things. And thank you so much for joining us today.